Welcome to the Oregon 100-Year Water Vision video series on how water connects us all. This short video connects clean, abundant water to our own human health and the safety of our communities. Check out OregonWaterVision.org to see the other videos in this series and tell us why water is important to you. Much of water management is tied to protecting the public's health and safety. One of the biggest jumps in life expectancy in U.S. history happened when cities built sanitation systems that concentrated on clean water. People in Oregon don't die from cholera anymore. Similarly, we built a lot of infrastructure to store water and manage floods, like dams and levees. These were built to generate energy, protect homes and farms from floods, and make sure there was enough water in summer to irrigate crops. All of those advances were made in the first half of the 20th century. So how is water connected to human health and safety now? Cities, community water systems, and even private well owners work with the Oregon Health Authority and Department of Environmental Quality to make sure the water we drink and use for cooking and bathing is free from toxins, bacteria, and other contaminants that could impact our health. Speaking of health, did you know that almost 90% of your health is determined by your zip code? Where you live and the people you're connected to can make a bigger difference in your health than your time in a doctor's office. If people who grow food don't have enough water or a shady place for a break, that increases health risks. If a low-income family has to choose between paying for food and paying for water, that creates chronic stress. Things like the affordability of water and disruptions caused by flood events have impacts on physical and mental health. We need to make sure water in every community is clean, reliable, and affordable, all parts of improving health. When it comes to deciding where to invest in water infrastructure, we also have to pay attention to health inequities. One way we can help reduce health inequities is by ensuring that all communities have reliable access to clean, healthy water supplies. Safety and health are connected. We believe strongly that our infrastructure, both things like dams and levees and things like healthy forests and floodplains, will keep us safe. When we feel safe, we're healthier and we can work with our community to grow and thrive. It's been a while since we've upgraded some of the critical water infrastructure that keeps us safe. Many of our dams were built in the 1950s, and some dams in Oregon are even older than that. We need to invest in the kinds of seismic and other improvements for critical water infrastructure to be safe and resilient. We also need to update areas at risk of flooding with harder rainstorms and changing sea levels. So what would it look like if every dollar we spent on creating access to clean, abundant water also made us healthier and safer? Here's where research and evidence show that water management can improve health and safety. By keeping toxins out of the water we drink or use to grow food, think lead, mercury, nitrates, and arsenic. By making water service affordable so water bills don't cause stress for low-income households. By ensuring floods, landslides, or other disasters don't destroy a community because they have built resilience. And by earning trust that water managers are protecting our health and safety. So when you swim in that river, take a sip of water from your well, eat that freshly caught fish, or go for a walk along the top of the levee in town, know that continued federal, state, and local investments in built and natural infrastructure are working to help keep us all healthy and safe. Thank you for tuning in to learn more about the 100-Year Water Vision. Check out OregonWaterVision.org to see the other videos in this series and to tell us why water is important to you.